Hi everyone, and we are thiazide-like diuretics.
1, 2, 3.
Thiazide-like diuretics have the same mechanism as that of thiazide diuretics, but they have different chemical structures. So, if you are interested, just keep on watching. My generic names are chlorsalidone with the brand name of Hygraton, indapamide with the brand name of Lozol, and metolazone with the brand name of Microx and Xaroxolin. And my chemical name is a bit complicated, so I'll just flash it in the screen.
Hi guys! I am also a thiazide-like diuretics. My therapeutic drug classification is diuretics, while my pharmacologic drug classification is sulfonamides.
My pregnancy category is category B, since there are no adequate and well-controlled studies on pregnant women, but studies have been performed to mice, rats, and rabbits, and revealed no evidence of impaired fertility and harm to fetus. But animal studies do not always predict human responses, so I am only given to a pregnant woman if I am clearly needed, since I can cross the placenta.
My mechanism of action is that I inhibit reabsorption of sodium and chloride in the distal renal tubule, increasing the excretion of sodium, chloride, and water by the kidneys. I bind the chloride pump in the distal convoluted tubule, hence inhibiting the reabsorption of chloride. Sodium passively follows chloride as a mechanism in maintaining electric neutrality. Water then also follows sodium.
Thiazide-like diuretics are only available in oral form. I am well absorbed in the GI tract with an onset of 1 to 3 hours after administration. Peak effects will be achieved within 4 to 6 hours, and the duration of my effects is up to 6 to 12 hours. I am distributed largely since I can rapidly concentrate within erythrocytes. I am metabolized in the liver and excreted in the urine. 50% of the dose is excreted and metabolized. My excretion is characterized as biphasic excretion since it starts with a rapid phase followed by a slow secretory phase.
I am medicated in treating hypertension or edema caused by heart failure, renal failure, hepatic cirrhosis, estrogen therapy, and other conditions. Also, for hypertension, I can be used alone or together with other antihypertensive.
I am contraindicated to patients who are hypersensitive to sulfonamide, patients who have anorexia, hypovolemia, and renal disease, failure or impairment, patients with orthostatic hypotension and syncope, and to those patients who have undergone sympathectomy, and also to patients with pancreatitis. I am used in caution to patients with systemic lupus erythematosus, patients who have long exposure to sunlight or UV, to breastfeeding mothers, and to neonates, especially those who have jaundice.
For my side and adverse effects, I can cause dizziness, vertigo, paresthesia, weakness, headache, drowsiness, and fatigue. In your cardiovascular system, I can cause orthostatic hypotension, venous thrombosis, volume depletion, cardiac arrhythmias, and chest pain. For your skin, I may cause photosensitivity, rash, purpura, exfoliative dermatitis. In your GI tract, I may cause anorexia, vomiting, dry mouth, diarrhea, constipation, jaundice, hepatitis, and pancreatitis. In the genitourinary, I may cause polyuria, nocturia, impotence, and loss of libido. In the hematologic, I may cause leukopenia, agranulocytosis, aplastic anemia, neutropenia, fluid and electrolyte imbalance. And other side effects I may cause muscle cramps, muscle spasms, fever, gouty attacks, flushing, weight loss, and hurinuria.
To nurses or student nurses out there, here are your nursing responsibilities before, during, and after administration of thiazide-like diuretics. Before administration, you have to assess any history of sulfonamide hypersensitivity, fluid or electrolyte disturbances, renal or liver diseases, systemic lupus erythematosus, and status of pregnancy or lactation. Also, you have to perform a physical assessment, especially to the skin, to inspect edema, to the cardiopulmonary system, such as blood pressure taking, pulse taking, and auscultating heart and lung sounds. Also, you have to obtain current, weight, and to monitor intake and output of fluid. And lastly, you have to monitor laboratory results of serum electrolyte levels. During administration, you have to follow the rites of administration. If there is GI upset, you have to administer me with food or milk. And lastly, you have to administer me early in the morning so that increased urination will not disturb sleeping. After administration, you have to ensure ready access to the bathroom, assess for CNS side effects such as orthostatic hypotension, and establish safety precautions if present. Monitor body fluids and regularly check body weights. And lastly, provide mouth care and give small, frequent meals.
So that's it for this video. I hope you learned something about thiazide-like diuretics.
See you! Bye!
Bye!